Thank you so much, Matthew. So my name's Dr. Antonia Carroll, and I'm going to be talking about how to best look after your nerves. So I'm a neurologist and I'm a neurophysiologist, and I work at the amyloid services at both St Vincent's and Westmead. So when we think about patterns of nerve dysfunction in amyloid, there are 5 major patterns, and some of these might actually be relevant to you, some of them might not be relevant to you. So we'll just talk through the little patterns first. So the first pattern is a mononeuropathy pattern. We typically see that as carpal tunnel syndrome, so usually numbness and tingling in these 3 fingers, waking you up in the middle of the night, causing you to need to shake the hand. The second pattern here is its radiculopathy or plexopathy pattern, which is when actually the ligament at the back of the spine gets infiltrated with amyloid and it puts direct pressure on either the spinal cords or the nerves in the back of the legs. And that can cause sciatica, shooting pains from the back, down the sides of the legs, can give you problems in terms of your walking, in terms of pain, or your legs feeling like they might give way after you walk a certain distance, what we call neurogenic claudication. And then these last 3 patterns are the patterns that you typically think of when we think about neuropathy. So the first pattern is the small fibre neuropathy, which is where you get burning, uncomfortable, tingling pains. Sometimes things that shouldn't be painful feel painful, usually starting at the toes and spreading up the legs. And that often goes along with what we call autonomic neuropathy, which is the autonomic nervous system controls all the things that you normally don't think about that happen within the body, the things that are usually involuntary, your blood pressure, your bladder, your bowels, erections, sweating, those sorts of things. And when those nerves are affected, any of those processes can become dysfunctional. And then the last pattern is what we call this glove and stocking length-dependent neuropathy. Now, when most neurologists or most doctors talk about neuropathy, that's what they're talking about. So usually it's where you get numbness or tingling in the feet, again spreading up the legs, can start in the hands, can even involve the tummy sometimes, which often leads to a lot of confusion amongst clinicians thinking that there might be a problem with the spinal cord. So depending on what type of amyloid you have, you may have slightly different likelihood of having each one of those different 5 types. So if you have wild type amyloidosis, for example, you're more likely to have the carpal tunnel syndrome and the lumbar canal stenosis. However, if you have AL or if you've got variant TTR, you might be more likely to have the autonomic and the large fibre neuropathy. So what I'm really going to be talking about today is what we do with neurological assessments and what the symptoms that you might get and how we can best optimise those symptoms. So our aims when we see you from a neurological perspective is to diagnose nerve involvement, to monitor for any changes in how your nerves are functioning, to treat the underlying disease, which I'm not going to talk about because we're going to have lots of talks about that later on, and then thinking about symptomatic treatment. So how we can improve your symptoms, how we can improve your quality of life, how we can maintain your function. And as you've heard, there's lots of pushing and pulling that happens with different specialists. So it's really important that this is done in a multidisciplinary setting, not only between your different clinicians, but also with other allied health staff members, so occupational therapists, physiotherapists, podiatrists, etc. And of course, you are at the centre of that, so it's important that you know where you're up to. So when we come to monitoring neuropathy, actually the most important thing is your story, and I will ask you questions over and over and over again about what's happening and what is changing with you, because actually that's the most important thing to me, to work out how to best optimise your care. So I want to know about the timing of when things happened, how quickly things are progressing, the types of nerves that are involved, what that's doing to your function and your quality of life, because that's the best way that I can work out how to manage what's going on from here. We'll need to do examinations to be able to monitor things objectively, and sometimes I'll even get you to fill in scorings to be able to work out how things are going from a quality of life or a functional perspective. And then we might need to do tests. So typically you might be asked to do nerve conduction tests, which is what you're seeing at the top right up here, where we actually test the sensory and the motor nerves. But sometimes, especially if you've got the small fibre and the autonomic neuropathy, those tests might be normal, okay? So we often need to do specific tests for small fibre and autonomic. So that can include postural blood pressure, so I'll often get you to lie down, stand up immediately, stand up for 1 minute, 3 minutes, do blood pressures over time. But then we can also do all sorts of kind of other funny, unusual tests that we might bring you back for. And depending on where you are looked after, some sites might have those, some sites might not have those. We might need to get you to do nuclear medicine testing to have a look at how quickly your gut is transiting, for example, or you're looking at your heart rate from that perspective. And we might need to do other special tests like MRIs or other blood tests. When it comes to sensory symptoms, so if you can't feel your feet, it's really important that we actually check your feet really regularly, because you can get calluses, you can get ulcers, and we can get problems with your nails. So it's really important, particularly in the Australian context, that you're not walking on hot surfaces without wearing shoes, and really we suggest you should wear shoes outside all the time. Your shoes need to be fitted properly, and if you can't see your feet and you can't get to your feet, you need to get somebody else to look at your feet. If we are not being able to feel our feet appropriately and not look after our nails and get to our nails, we actually need to see a podiatrist every sort of 6 to 8 weeks in order to have that looked at appropriately. And that can either be done locally or via a high-risk foot clinic. Now, sometimes when we have nerve involvement, we get neuropathic pain, so that uncomfortable burning, tingling pain. And you'll know that there are a couple of different medications that we can use in this circumstance. But really, it's a bit of a trial and error to work out what works best in you, because what might work best in one of you might not be the same as the other. And it also has different impacts upon what other organs are involved. So in general, when we think about amyloid-associated nerve pain, we often go for medications like pregabalin or Lyrica or gabapentin, which is also called Neurontin, as a first line. And then second line, we use medications like tricyclic antidepressants, and that's just because of the risk factor profiles and the side effect profiles that sometimes we see. But there are lots of other options that you can know about, including other oral options, sometimes even topical options, patches or creams. Sometimes we use cannabinoids, so medicinal cannabis, but we don't often use opioids because it's kind of better for bony pain rather than for nervy pain. There are lots of complementary therapies that can also be helpful for sensory symptoms. So some people find that supplements can be helpful, ensuring that we're getting enough dietary involvement, things like B12, massage, physiotherapy, acupuncture, meditation, and even transcutaneous electrical nerve stimulation can be helpful in some. We like to optimise your diet as much as we can, making certain that you're eating meat, veggies, all the colours of the rainbow to make certain you've got the important building blocks for your nerves. That we talk about exercise, and we'll talk about that a little bit more. And then we want to try and minimise anything else that could impact your nerves. So things like diabetes or B12 deficiencies, and avoid nerve toxins where possible, recognising that sometimes, say for example in AL amyloidosis, we need to give you medicines that can affect your nerves. And so that's why I say where possible, but that's why we watch you really closely in that context. Now, if you develop weakness, the mainstay of what we can do to help you here is with physiotherapy and occupational therapy. So we really want to give you strategies to really optimise your function. We want to make certain that you're safe. So we might need to suggest walking aids, looking at how there are obstacles in your house, what are the rails situations like? Can we provide assistive devices, such as over-the-toilet aids to help you get up, or rails from that perspective? And then how can we optimise your fatigue management and limit your energy expenditure so that you can do the things that you want to do? They're also really helpful from a physiotherapy perspective and an exercise physiology perspective about guiding that exercise. If people have foot drops and they're unable to clear their feet, actually using objects like a foot up here or an AFO can be really helpful in order to get that foot clearance to reduce your risk of falls. And then certainly we see that actually a large proportion of patients with amyloid get cramps. And so in that circumstance, stretching, massage and hydration can be really helpful here. Also magnesium supplementation and gabapentin as a nerve pain agent. But actually there's some evidence to suggest that even drinking a shot of pickle juice before you go to sleep can actually be helpful as well. When it comes to exercise, as you've been hearing from Ellen, there are benefits across the board, okay? It helps with your cardiovascular and your fluid management, your mood, your muscle mass, balance, but actually also with your nerve function. So similar to what we recommend from a heart perspective, 30 minutes of exercise, or what we classify as moderate exercise, 5 days a week. And we're talking about building up to this, not starting this immediately. So that could be walking, hydrotherapy, swimming or stationary bike, can actually improve this nerve fibre density, what these tiny little nerve fibres in the skin over time. And that can be really helpful to do that either on your own, but it can be guided by either a physiotherapist or an exercise physiologist. And you can get your GP to refer you for Medicare rebated sessions. Now, the other big symptom cluster that really does affect people with amyloidosis is these autonomic nervous system symptoms. And I'm really going to focus on postural hypotension because it's a really tricky one to manage. So first and foremost, postural hypotension is when you stand up and you get lightheaded. You usually drop your blood pressure by 20 systolic or 10 diastolic. And the first thing we'll want to look at is this push and pull between that, usually your cardiologist and your nephrologist and your neurologist, okay? So we want to rationalise any blood pressure lowering medications. And this does require a bit of crosstalk. There are simple conservative measures that we can do. So as Ellen was saying, often she's going to say, reduce your hydration and salt. I might say, can we have a little bit more? And again, we need to do that talk. You want to slowly rise from lying or seated. You can pump your muscles and do other manoeuvres, such as these manoeuvres, which, as you can see, can increase your blood pressure. And even elevating your bed can be helpful. We can think about things like compression garments, whether abdominal binders or stockings. And sometimes if people are getting lightheaded after eating in particular, that's what we call postprandial hypotension, where the fluid and the blood pressure all gets dilated within the gut and away from your head. So in that context, avoiding large meals, and particularly those that are high in carbohydrate and alcohol, can be really helpful. And even considering having a little bit of caffeine, a shot of espresso like the Italians after lunch, can be helpful just to constrict those blood vessels. If those simple things aren't working, then medications can be used. And so we have a whole gamut of medications, usually things like midodrine, sometimes fludrocortisone if we don't have a lot of cardiac involvement, and then sometimes more specialised things like doxydopa and octreotide that you can be discussed with your family GP, with your family of doctors. And I think the key thing that we need to really watch out for is that you're not getting too high blood pressure at night time when you're lying down, okay? So in order to minimise that, we can do the helt up tilt, and we need to make certain that you're not having any of these medications about 4 hours prior to bed, because over the longer term that can cause issues with your kidneys and your heart and your brain. But also with postural hypotension, we need to think about safety, making certain that you're not having falls, okay? So again, that's where your occupational therapists come in and your physiotherapists in terms of walking aids. It's really important to keep on moving, because actually your muscle pump is what keeps pushing that blood pressure up from your feet to your head. And so if we're not getting up, you're not able to have those medications. And if we're having trouble with the exercising upright because of blood pressure, actually exercising in bed or in doing sequential tilting can be really important. We also need to make certain that your albumin, which is what keeps all of your fluid in your blood vessels, is optimised. So that really involves your diet, and we need to make certain that, if you're not getting enough albumin, we need to really increase your supplementation to keep that fluid up there. Now, I was going to talk a little bit about the digestive tract, but we're running a little bit late. We need to keep to time, so I'm going to keep on going through there. I think the last thing I want to say is that all of these symptoms really affect your quality of life, okay? And there is huge impacts on your mental, emotional, physical and financial components, and loss of independence that comes along with that. We often see that you are very concerned for your family members, not only in terms of heritable diseases, but also because of the carer role. And there's a lot of uncertainty. So in this context, anxiety, depression and isolation is really common. So I think it's important to recognise that you're not alone in this circumstance. Seek help from your family, friends, your support groups, your counsellors and your doctor team, okay? So in summary, amyloid can affect the large, small and autonomic nerves. We see a whole range of symptoms that may affect you in slightly different ways. So we do want to limit the underlying disease to stop progression, but there's actually a lot that we can do to help. So what we really wanted to show you today was kind of the range of symptoms that you might experience, so that you feel empowered to discuss that with your treating team, and recognise that we do need to have this coordinated care in order to treat the symptoms, improve function and your quality of life. Thanks very much.